Nobody is talking about this on the internet, but it does not mean that complications do not happen. Hi, I am Aditya Parikh, your urologist and uro-oncologist. Complications are a part of every disease and every doctor's day-to-day life. Complications don't happen because there is negligence or the doctor is not competent. They happen because medicine is a fight between a doctor and the patient as a team against nature. We, however, have sort of made an impression on social media that all our successful surgeries are the only ones that we have and that there is no complication. This is misguiding because every patient should be aware of the complications of the disease that they have as well as the potential complications that can happen if they have the treatment. Today, let us talk about the complications of kidney stones and the treatment modalities of kidney stones. We're going to break this video down into a few sections. The first will be complications that can happen because of kidney stones themselves. Secondly, we'll talk about the complications that can happen from medical expulsive therapy, that is the medical treatment of kidney stones. The third, we're going to talk about complications that can happen from the surgical modalities of kidney stones, that is shockwave lithotripsy, RIRS and PCNL. And in the end, it will be a heart-to-heart conversation with my doctor friends around the topic of complications. So kidney stones are a notorious disease. They are not just recurrent, but they are extremely bothersome. Kidney stones can get stuck in that pipe called the ureter that comes from the kidney into the bladder. And when they get stuck, if they remain stuck for a long time, they can cause damage to the ureteric wall, leading to what is known as an impacted stone and ureteric stricture. Because of the back pressure onto the kidney, there can be a formation of urinoma around the kidney. This urinoma is basically that part of the kidney gets ruptured and urine, instead of going down, goes outside the kidney. There can be infections that can happen because of kidney stones. And the worst complication that kidney stones can cause is the loss of kidney function. This usually happens when either the stone grows to a very large size in the kidney and causes chronic infection, or a stone gets stuck, goes unnoticed and untreated, and therefore causes back pressure on the kidney for a long period of time. Now we come to the complications that can happen because of medical expulsive therapy. To understand that, let us first start with what medical expulsive therapy is. Medical expulsive therapy is that certain medications are given to enable the passage of stones that are stuck in this urine pipe called the ureter when they are less than 7 millimeters or so in size. Sometimes the pain goes away, but we are not able to get rid of the stone, or the patient does not pass the stone by themselves. So what becomes very important in this case is that a follow-up is done with some sort of imaging, either an ultrasound or a CT scan. This will enable us to ensure that the stone has passed and not just rely on the fact that the stone was small and so it must have passed because it is not causing any symptoms. Because sometimes it can be too late to salvage the kidney if these stones go missed. There is also this concept of flush therapy, also popularly known in India as Batla therapy, where lots of fluids are given from the outside to enable the stones to pass or to push the stones out of the urine pipe. This is now condemned in modern scientific discussions because if the stone has to pass, it will pass. However, if the stone is stuck and you keep giving too much pressure from the outside, you can actually lead to formation of a urinoma, you can lead to rupture of the chelicus within the kidney, and the pain can actually become worse. And therefore, flush therapy is now completely condemned in modern day urology. The patient is asked to drink more fluid by themselves so that the body has a mechanism by which it can then throw out more urine. Sometimes diuretics are given that are oral medication, but all of this is based on the size of the stone, the site of the stone, the kind of symptoms that the patient is having. Now we come to the complications of the surgical modalities. The first and the least invasive of the surgical modalities is shockwave lithotripsy, which is ESWL. In ESWL, the patient is given a light sedation and from the outside, there are shock waves that are bombarded onto the stone under the vision of an X-ray or an ultrasound. The shock waves then break the stone down into small fragments. When these stones break, unfortunately, the breakage of stones is not controlled. Therefore, there can be formation of slightly larger fragments. The complications of ESWL can be divided into complications that happen because of the procedure and then complications that can happen because of the fragments that have been formed. So when it comes to the complications that can happen because of the procedure, these are bruising of the skin because you're giving shock waves from the outside. It is that there could be an injury to surrounding organs. There can be, and these organs are the lung, the colon. There can be injury to the kidney leading to a formation of clot around the kidney known as a hematoma. There could be bleeding from the urine or infection that can set in after the procedure happens. There are another set of complications because of the fragments of stone that are formed. The most common being that these residual fragments remain behind in the kidney and they form a nidus or a source of recurrence of stone formation. There is sometimes a lining of the stones in the urine pipe. In medical language, it is called a stenstrasse, which is that there is a line of these stones within that urine pipe causing a blockage and in fact making the symptoms of the patient worse than they were before. This requires a secondary procedure sometimes in the form of placing a stent or primarily putting a camera inside the ureter and removing these stones. USWL, however, is a safe procedure and in the right set of patients can give excellent results. Coming to PCNL, which is percutaneous nephrolithotomy. This was the procedure that revolutionized kidney stone treatment from the old age of having a big cut, which is an open operation, to having just a small hole placed in the flank and using special equipment and cameras to remove those stones. PCNL can be standard or it can be a miniaturized PCNL depending on the size of the stone that is being treated by it. When the stone is large, there is an inherent risk of complications happening with no matter what procedure is done. And therefore, with a standard PCNL, there is a higher risk of bleeding. With the miniaturized PCNLs, there is a smaller risk of bleeding. Often, it is misunderstood that a puncture in the kidney will lead to a loss of kidney function. In scientific literature, it has been very well documented and proven that it does not happen. Therefore, we have to remember that PCNL is largely a very safe procedure. However, the risk that can happen with a PCNL and the one that we are most worried about is bleeding. This bleeding is most of the times very easily controlled during the operation or by some maneuvers that can be done after the operation. Only in 8 in 1,000 patients is a secondary procedure required, which is in the form of a selective renal artery embolization to take care of the bleeding, which is a sort of angioplasty-like procedure that may need to be done. However, this is extremely rare. As I said, it is only 0.8%. The other complications with PCNL are injury to some part of the kidney, injury to surrounding organs like colon and lung, formation of a fluid collection within the lung, or sometimes there can be bleeding and infection that can happen with PCNL. That said, most of the patients will go home in 1 or 2 days after the operation, and in terms of efficiency and stone clearance, PCNL is an outstanding procedure. Now we come to the third modality, which is RIRS, also known as flexible ureteroscopy. In this, the natural orifice of the body is used and a scope or a camera is placed inside the kidney. The stone is fragmented or broken down with the help of a laser, and small dust is left behind and a stent is placed on most occasions to enable that stone to come out. Now the complications of RIRS are the most worrisome is sepsis, which is infection which also causes a damage to some other organs. This is a rare complication, not something that is seen in many patients. There are certain steps that should be taken to prevent this complication, which is that before the operation, the patient should have a negative urine culture. That is, there should be no infection, or the infection should be well treated before the patient is taken into the operation theater. The other is using high quality sterilization or disposable scopes. And the third and the most important is responsible case selection and responsible use of the laser machine. The recent advances in technology have given us very, very powerful lasers, but we all know that with great power comes great responsibility. And irresponsible use of laser is one of the most worrisome and dangerous things that can lead to bleeding, and in the long run, it can lead to a formation of a ureteric stricture if it is not used cautiously, or damage to the kidney in the long run. RIRS is generally sold as a safe procedure, but one must be aware that it is only in good hands that it is a safe procedure, and it is very important that caution is maintained and all the right steps are done to keep this procedure a safe procedure. In the end, I have a heartfelt appeal to my doctor colleagues that we have now entered an age where information is very easily available on the internet, and a lot of this information is heterogeneous. Therefore, as doctors, it is our responsibility to ensure that our patients are well educated. From a medical legal standpoint as well, it is very important that documentation of what has been explained to the patient, and making sure that the patient is explained about the potential complications that can happen with these procedures is documented well, which will keep not just medical legal safety, but also ensure that the patient is educated and that the doctor and the patient remain in the same team while fighting against these diseases. Thank you very much. Hope you have a nice day.